Hey everyone, what's up? It's Rachel here. Today I'm here with Ben and Michael. They are the founders of Aimedis and they're going to be joining us for this AMA today. Hey guys, how are you?
Hi,
Hi,
Rachel.
Rachel. Thank you very much. Very good. How are you?
I'm doing well, thank you. Thanks again for
Great.
joining us today. And thank
Great.
you to the audience for joining us. Be sure to drop your questions in the chat and to subscribe to our YouTube channel. So Ben and Michael, first question to get us started here. What is Aimedis?
Yeah, so what is Aimedis? Aimedis is a medical ecosystem, an operating system that combines nearly all e-health applications that you can find, combining medical records, video chat, prescriptions, appointments, second opinions, the connection of tracker devices like the Apple Watch or Withings in one ecosystem to offer these services to patients, to doctors, to nurses, to all healthcare providers on the market, which is the basis of Aimedis. But Aimedis is not only these e-health applications. We are actually moving towards the using of medical data and the claiming of medical data by building up an NFT marketplace to sell the data and to gather it and to standardize it.
Wow. Okay, cool. So medical data being turned into NFTs then. Is that part of one of the main concepts here?
Exactly. Yeah, it's one of the main
Absolutely.
concepts. You know, we have launched the platform by offering the patient-centered services to build a base, right? To build a base for this ecosystem. But we're now shifting more and more towards B2B services. So combining these services and offering the data combined in NFTs. I will explain later why we will do it in NFTs and not just in zip files or data packages. And adding more services like one tool that we call Aimedis Virtual Hospital, which is a hospital and practice information system that is also combined with the system. And yeah, so that's what Aimedis does.
Got it. Yeah. Ben, could you tell us a little bit about how this idea came about? Because it seems like there's a lot of concepts here. So I'm just kind of curious. It seems like this is decentralized healthcare, but can you elaborate on that a little bit?
Yeah, well, actually, when we started, it was our aim to kind of have a system that really reflects how healthcare works and that really connects all the important stakeholders in healthcare, make them come together and exchange the important data and information that we have. And we need, of course, to not only improve our workflow, but give patients the best outcome. So it came really out of necessity. We've been working in hospital. We've seen the problems in healthcare. We've been working in pharmaceutical companies as well. So we had some deep insights within that time about the deficiencies in healthcare. And that made us think about a system that we started to build a few years ago and continued persistently, going step by step and leading towards a meanwhile already working system. Of course, it's a system that we will, of course, extend to bring all interested and important stakeholders to place and work with us on a platform that allows, not only exchange of data, but provides services and it gives a benefit to everyone that uses it. And we deeply believe that there's huge benefit in the digitization of healthcare, not only to the ones that work in the space, but for patients as well.
Mm-hmm. So it seems like you guys are taking healthcare data and putting it on a blockchain network to connect all parties involved, correct?
Exactly. Yeah, correct. You know,
Right.
the thing that a lot of people ask us why we do everything in one place. And you know, we've both been working as doctors for long years. Ben and I, we studied together medicine in Düsseldorf, and started our career together in hospital, so we had a good connection there. And the thing about healthcare in healthcare IT is that it's not comparable to normal IT. You know, when you look at different types of applications like banking or shopping, you know, you can create single apps that people use. But in healthcare, it's a little bit different, because you have the hospital IT that will not go away, right? Especially in the industrialized countries, there are established companies and established IT systems that will stay there forever, or for an uncertain duration of time. And when you come with a new application, you will not go to a doctor or to a hospital and say, hey guys, we have an app for video chat, we have an app for diabetes, we have an app for blood pressure. It will not work, because it's even difficult to teach the staff in hospital, to teach the patients use one system. And if you have different apps, like 1,000 apps on the phone, no one will use it. So you have to standardize it and create a space, you know, like a little bit, you know, like a shopping mall where you offer every service. So people just enter this one shopping mall and they can select from the different services using one user experience, one user interface, one login, which is very important. And so they don't have to switch between the systems. Besides, we make Aimedis interoperable with the existing healthcare IT, supporting certain standards that are there in healthcare, like FHIR, HL7, you know, all this stuff. And we also address the different regulations, GDPR in Europe, HIPAA compliance in the US market, and FDA compliant, you know, in the markets in Asia, for example, in the Philippines. So you have to combine everything in one and not in different applications.
Right. I'm curious to know about the technology behind it. So this is built on a blockchain network, correct?
Yeah, it's correct. It's not, you know, it's not only a blockchain system. The blockchain is there to add a service level, basically. You know, when you have a healthcare IT system, there's a lot of trust issues. You can tell people as a company, you can tell doctors, guys, we encrypt the data. We don't see your data. We do not access your data. Your employer is not accessing your data, but people do not believe you. They tell us it's like that, but who knows, right? So you have to create an additional level of trust. And that's why we use the blockchain for, you know, because patient has their own access to their part of our blockchain, of the Aimedis blockchain, and they can follow up exactly who accessed the data, who uploaded this PDF, who uploaded that X-ray, who accessed my emergency files, when, and with what right management setting. Why did this person access my records? So this gives an additional level of trust. Besides, we also store data in the blockchain, not everything, but certain parts of the information. And we, not in this version that is already running, but the next version that is coming up, we will even more decentralize the blockchain nodes and the data by storing it on devices of users, for example, to build this, you know, to build this additional level of trust, which is absolutely important, because otherwise people will not believe you, because medical data is the most valuable and the most critical data that you can handle. More valuable than banking or shopping information. You know, Facebook, Instagram, all these companies, they are dealing with data. And there we talk about, okay, John went to cinema on Friday, and everyone says, okay, this is important information, but let's talk about a cancer disease. Let's talk about chronic diseases, which is much more valuable and much more important. So you have to save it and you have to give people trust.
Right, definitely. Just want to remind our audience and our listeners to drop your questions for Ben and Michael. I have a question, actually. So there's a token associated with this platform. Can you chat a little bit about the token and explain the purpose there?
Yeah, sure. Ben, you want to talk? You want to explain it?
Yeah, well, actually, like Michael said, it's an ecosystem, right? So we have several services that you can pay for on our platform, and using our token will always discount the price. So this is the first thing. The second thing is that we are working on a platform that is called the social medical platform, where patients can interact with each other and with healthcare professionals, create content. It could be video content, it could be written content, whatever kind of content. Therefore, make the platform itself more valuable, containing a lot of healthcare information. And for this creation of content, they will be incentivized. So this is one thing. The other thing is, of course, that we connect hospitals and pharmaceutical companies and patients on a platform that allows to also stream advertisement. And so if there's a company that wants to have advertisement on our platform, they will pay either with fiat money or our token, which also will be massively discounted. So that's the main thing for the token.
Yeah. Let's not forget about, that are the actual use cases that we have available now. In the next steps, combining it with the NFT marketplace, you will use the token to mint, to buy, to sell the NFTs, the data NFTs, which will also give you a price advantage, which is very important to look at other NFT marketplaces like Rarible, where you can also use the token, etc. And we also give people in the next stage of the company, the token holders, the possibility of governance. So token holders can decide and can give their input and decide about functionalities, about product development inside the social medical network, for example, right? And what also is very important about the token, at the moment it's not, but it will be a DeFi token. Why will it be a DeFi token? The thing is that, let's imagine you have data NFTs as a hospital. Maybe you're a third world hospital and you have a lot of data that you can sell and that you can gather, right? Then you can leverage the data inside the NFT marketplace against the token and against real money. So you have a real value behind it. Because let's speak about the NFTs a little bit. Up to now, it's very difficult / impossible to price tag medical data. Pharmaceutical companies need it, research needs it, hospital needs it, even AI companies will need it, car manufacturers, space agencies, everyone will be in need of medical data. But at the moment, you don't have a possibility to say, what's the value of a data set? Let's talk about the patient that has some chronic diseases, like a heart disease, like high blood pressure, or maybe a cancer disease or some other chronic condition. You are not able to price it. You're not able to handle it comfortably. Bennett, we both have been also working in the pharmaceutical industry. I myself have been a drug safety officer for some time, and I did some research, and I had to do a lot with medical data and with research data. And it's a big issue because sometimes you get digital forms and you also get paper sheets where the data is written, and it's crossed away, it's deleted. It's really, you don't have, let's imagine you have a medical trial going on. It's really difficult to get good data, and pharmaceutical industry and also other industries spend billions in these data because they need it. But the quality of the data sometimes is really, really bad, and you have to work something out to make it happen, to make the pharmaceutical trial happen, and to find a good way and a reasonable way to have a trustful trial, right? And with the NFTs, what we do is we store data inside the NFTs, will be indexable, which is very important. And it's structured in a certain way, and it's always in the same quality, and it's not changeable. So it's immutable on the blockchain. You know where the data is coming from. It will be anonymized, which is very important. No one inside the platform has to give the data. It's never mandatory. People can always decide to do so. And they can anonymize the data. They can put it into an NFT. They can, a doctor / hospital or a researcher can sign it. So you have a signature of an authority behind it. You put it onto the chain, you sell it. You can follow up where the data is coming from, where it's going to. It's not been ordered. It's not been changed. It's not been manipulated. And it's always in the same structure, which is highly valuable. Imagine AI, which will be the future, not only in medicine, but in every type of industry. But AI and machine learning is always depending on high quality data. And if you have paper sheets where everything is crossed away and you have this bad data, you can have a very, very good AI, but the AI can't work because it doesn't have good data. With these NFTs, you will have high quality data, always in the same structure, reliable. You can put it in any trial, AI, or research, whatever you want to do, and it's anonymized, so no one has a disadvantage from that. And combined with smart contracts, everyone gets its part. So there is no, patients don't have to fight for money, like, and nowadays still it's done in poorer regions of the world. People are being exploited for their data. They are part of trials and still don't know they are part of a trial, which is highly unethical and which is really bad. With this kind of technology, we will pass this, and we will create completely new ways of income streams, income revenues for poorer regions of the world, but also for everyone who wants to take part in this, and everyone is participated. So it's a win-win-win situation for everyone without disclosing the origin of the data, which we think is a big opportunity and a real advantage.
Right, definitely. I mean, there are a number of advantages to a platform like this. And I actually have a follow-up question, but before I ask my question, we have a question from the audience from Factory Data Lab. They're asking, what do you think about Apple and Google? They are focusing also on the healthcare market, and they are close in contact with the end user. They track their fitness and health data.
Yeah, we think this is very important. It opens the door for e-health, because if you're alone on the market, it's always a bad sign, because you say, why am I alone? Maybe it's a bad idea. But Google and Apple, they have big divisions, although there are some setbacks. Just read about that Google Health is shutting down certain services because, everyone is talking about these regulative problems. Everyone is saying, hey guys, GDPR, HIPAA, it's different. Every legislation, every country has its rules, but that's something that will be overcome. That won't be a problem in the future, because the demand for e-health is high. And Apple and Google also have seen that. They've seen that 10 years ago, 20 years ago, maybe even, because the corona crisis now has shown it, that the healthcare system as it is absolutely insufficient. A lot of people don't go to hospital at the moment because they're afraid of infecting themselves with corona, and they are staying at home, but they're not in contact with medical services, with doctors. So what do? You have to have services like Aimedis, and like Apple and Google offer, definitely. So yeah, we like it very much, and we see a big advantage that the big players are also in this field and are pushing the development forward.
Right. Yeah. Go ahead, Ben.
Yeah, I think the question is more towards if we see them as a problem for our development, right? As a competitor, we don't see them as a competitor. They are huge, and at a certain stage, they might take over everything. But I think they will look for a company that has set the right infrastructure. Those huge companies, and by the way, we had some discussions with one of these huge companies here with one of the representatives. So we know exactly that they have a focus in healthcare as well. It's slightly different than ours. So we hope, or we maybe, let's say it that way, we could imagine that at a certain point, if we continue our journey, that one of these companies would step up and, kind of, works with us or takes us over, I don't know, something like that. But generally, yes, we see them working on processes. We see them working. I would say some of them have some very interesting developments in terms of hardware. In terms of software, I think that our approach is way more complex in some way, but way more user-friendly, and especially also, focusing on all stakeholders. Like Apple Health, for example, we know everyone has an iPhone, or let's say a lot of people have iPhones, they have their data on it, but have you ever tried to exchange your data with the next hospital? Up to now, it's not working because there's no focus on that, I think, from their side. And maybe the markets are up to now not prepared for Apple or Microsoft or Google, and we tried to find the right approach, and I think we did it. We have implemented some kind of very beneficiary functionalities that not only lead to interest from patients, but from doctors and hospitals and insurers and pharmaceutical companies. So this is something that I think we have that up to now they don't have.
Yeah.
Right.
The good thing about Apple, for example, also Google, but especially Apple, is the hardware that they have. That's also something that we focus on, not too strong at the moment, but hardware is a big point. Talking about the Apple Watch, I have it, and I just came out of a COVID disease. I had it. I was in bed 2 weeks, and it was really bad. And I measured at home my blood oxygen level all the time to see if there is an issue or not. So this is really democratizing the way how you can get your medical data. And we also can import this data that I have on the Apple Watch and in Apple Health with our platform and share it with the doctor and combine it with the information maybe you have gotten at a hospital or so. So very good.
Right. Yeah, definitely. Really good point. So my question is, I think the concept of NFTs and medical data makes a lot of sense, but how do you value and price that data when it's being, quote unquote, sold? How can you put a value and price on that? And what do the users get in return? Do they receive the tokens, or, how does that work?
Depends. The question is very good, because at the moment there is no real price tag. As I said, if you ask me now, Michael, what's the price for a medical set of informations, including blood pressure and diagnosis and allergies, I will tell you, I don't know. We will see, because we built this NFT marketplace, and there will be the opportunity to sell NFTs for a fixed price and also by auction. So we will establish this using the platform. We will establish these pricings, and we will establish the revenues that people get out of it. At the moment, this is depend. When you buy data as a pharmaceutical company, you're not only paying for the data. You pay for the gathering. You pay for you have, maybe if you do a trial, you have to collect patient data directly, and you invite patients. You have to pay them directly. So there is a big bunch of things around the data that you have to pay. So it's not clear what the price of the data is. The NFT marketplace will show that, and after some time we will establish fixed prices, because after a year or two we will know what is a company paying for a cancer patient information, what is a company paying for 100 patients that have high blood pressure. We will find that out and put a price tag on it.
Got it. And so is everything going to be transacted with the AIMX token?
That's an advantage for the users. So if they buy, mint, sell, etc., using the token, they will get a discount. So there is a high intrinsic motivation to use the token, but people will be able to buy it using fiat money, using Bitcoin, using Ethereum, whatever they like. So we are not urging people to use the token exclusively.
Got it. Yeah. I mean, that makes a lot of sense, especially considering the fact that you guys are dealing with major enterprises and people that might not be so familiar with crypto and blockchain. They might be frightened of, a token, and they might just want to stick with fiat. So having those options available with the NFT marketplace is actually really, really smart. Makes a lot of sense.
What you say is also very important. The platform, if 99% of the people using a medical platform, people with chronic conditions, they even didn't, or they haven't heard of the blockchain. So you cannot say, hey guys, use a blockchain, here's your private key, here's the token, use this, use that. People will be frightened, as you say. So when you use Aimedis, the blockchain functionality, the token happens in the background. If you want to use it, you can use it. If you don't want to use it, you're not urged to do so. So it's a system for everyone.
Right. Yeah. And you guys have nailed it, because obviously, like I said, with enterprise, they don't want to know about blockchain and tokens. They just want to know that the platform works efficiently. Exactly. So you guys totally nailed it there. I'm just going to take another question from an audience member. Animalist is asking, when will the Aimedis token be available to the general public?
So the thing is, at the moment, we are doing our IDO. We are in the pre-sale and seed sale period in the second part of it, because the first part has already been closed. And we are aiming to close the sale by beginning of September, first half of September, and are planning, not yet fixed, but are planning to do the IDO in September this year.
Got it.
Then it will be first listed on PancakeSwap and later on also on other exchanges, but for now it's on PancakeSwap.
Yeah, we have to find the right deal with token launchpads. So we are negotiating different options, but it will be very soon.
Got it. Also, I was wondering, when will the NFT marketplace be launched and available?
The NFT marketplace is in development at the moment. The test period will begin, I think, by October, and we want to launch it by this year.
Wow, that's so exciting. Okay, moving on from NFTs real quick. So there's lots more happening here. I know that there's a virtual hospital and rehab in the works. Can you guys discuss that and kind of explain the concept there?
Yeah, so virtual hospital is basically a hospital information system. So every one of you who knows or who's in touch with the medical or healthcare sector know the existing hospital information systems. Very bulky, looking like Windows 3.11 from 1995, with menus, submenus, and very user unfriendly. So the big companies, it's the same in the United States or in Europe. They have established this kind of software, and it's very pricey, right? So you have to pay millions to install such a system, depending on the country, depending on the healthcare system you're moving in, but very difficult to adapt to the developing countries, Africa, Asia, parts of these countries. It's very difficult. So we want to bring a new kind of hospital information system that is offering a completely new way of user interface and user experience. So it's like including a little bit of gamification, you know. It will be fun to use this hospital information system. You see where the patient is moving inside a hospital. You see where the examination is taking place. You can see where the patient is, in which bed the patient lies. Then the patient, you know, the staff is always up to date, and you can put tasks to a patient. So the doctors and nurses get a message on their smartwatch and see, okay, Mr. Schmidt has to get an ultrasound today. So you improve the way how the patient journey, you improve the patient journey a lot, and you participate, the patient and the relatives, the family of the patient, because the patient can log in and can see, tomorrow I have an ultrasound, the day after tomorrow I have a surgery of the spine, and then the patient can already click this surgery and he can search for information, he can see videos, he can download information. So it's a very interactive system, participating everyone within this journey, which is really a big advantage. And also we have a different price level module. So we calculate it on a monthly base. So we're not, hospitals don't have to pay millions to use the system. They just pay a monthly flat fee. I mean, depending on the patients they treat, but they have a fixed fee, and they always know the system is up to date. The system is monitored in real time, because security issues, that's a completely different topic, is a very big thing in healthcare. You know, at the moment, there's, you know, people from everywhere in the world, they're hacking hospitals, they're getting information, selling it, which will be a bigger problem in the future, and we are taking care that this is not happening. And yeah, so we established this virtual hospital, and rehab is a project that we established with our partner, Professor Hamberg. He's a neurologist from Germany, and he's part of the board of Aimedis, and he is a specialist in rehab, and he's part of the World Federation for Neurorehabilitation. And we want to bring interactive rehabilitation to the system. COVID crisis has shown that this, in times of crisis, rehab is taken down. So a lot of people that need rehab do not get it. That's a big issue, and thus we had to find a way to have people get their rehab, right? So, and you can do a lot of things online, you know, like tests, like neuropsychologic treatments, like questionnaires, like follow-ups. People can watch videos, they can get information, and that's what will be established using Aimedis virtual rehab. There will also be some applications with virtual reality and augmented reality in a later stage, not now. But so we bring all these kind of services to one platform, and that will be Aimedis, that offers everything, like, you know, this big bubble where you can just get everything and pick the bad things that you want.
Right.
know,
Yeah. I mean, this is. Oh, go ahead, Ben.
Aimedis Virtual Hospital is a very important issue, by the way. It really allows us to connect Aimedis to the big players in the healthcare system. You know, this was one of the obstacles. I mean, as Michael said at the beginning, when you have several apps, this is a cardio app, this is diabetes app, and you go to the hospital, the doctor has already a system that he works on. So this will take time to have a look onto your phone or whatever kind of device you have, and then get that information out, and then you have somehow to transfer it to the hospital information system. And you know, so we want professionals to use our system. Therefore, we had a lot of discussions. Of course, we started with building APIs to connect our system to hospital information systems. But then at the end, it was kind of obvious and clear, and it even, you know, came out when we spoke with hospitals that they said, okay, we would be interested. And recently it was very, very specific. So we started to build this virtual hospital information system so that at the end, everyone that is on the platform, professional, patient, can really work on our platform without exiting it, without having problems with APIs. So everything works flawless and efficient. And I think even in terms of usability, our hospital information system will be really something great. It is built on a system that hasn't been used in healthcare before. We have some orientation. We had some orientation in the industry, in the automotive industries. So we have a very, very user-friendly experience to offer. And I think hospital professionals, we are ourselves hospital professionals, and the one that we know will like to use it, and it will really make things very, very effective in terms of transacting and interacting with each other.
Right. I mean, this is clearly the future of healthcare, and it's so exciting to hear about this project. I mean, I can't wait for something like this. But we're getting a number of questions from the audience. I'm just going to take one of those real quick. Digital Enthusiast is asking, how big is the market that Aimedis will revolutionize? Is it the global healthcare market, or is it even bigger than that? That's a great question.
Yeah, it's the global healthcare market, because you know, you cannot work with an e-health system in one country only. People are not only in one country. Let's imagine, you know, let's talk about my mother. She's living in Germany and then going to Slovenia or going to Spain for some time, and she has some chronic conditions that have to be taken care of. And that's what a lot of people do. They travel. So you cannot just have a system in one country, working in one country. It has to be global. Imagine you have a heart condition, you're in Thailand. People in Thailand, doctors in Thailand need your information. So the global market is our place, our working place. And we already have started to work on a global level. So we're not only Europe, but also in Africa and Asia and Middle East. We're now starting to conquer the United States market. So yeah.
Got it. Yeah. Yeah, it's great because, you know, obviously when people travel, especially now, if you get sick and healthcare doesn't cover you in that region, you know, it's hard. And then the data being in all different places, it's so difficult. So this is really exciting. Peter Boda has a question. He's asking, how will the individuals be motivated to hold the tokens? Your idea is great. It helps the healthcare system, but why will private investors buy, hold, and sell the coin without any healthcare purpose?
So the thing about the token is, first, there is a staking model that we offer. So people that hold the token for a certain period of time, which is at least 6 months, will get tokens as a staking reward. That's very basic. Another thing is that we burn a certain amount of tokens, so it's a deflationary token, right? And what we haven't talked about yet, because it's not yet implemented in the application, but you know, let's talk about smartphones and the space. I have an iPhone and I got it, and it has 512 gigabytes of space, and I'm actually using 40 gigabytes of that. So what can we do with the space that users have on their phone? We will give them the option to share this space they have, right? To offer space for blockchain nodes for certain type of information that is encrypted, so they will not see it, they will not be able to access it, that's sure, and they will be paid in tokens. And thus the token will be deflationary, and also institutions, Ben said it correctly, so institutions that want to advertise on the platform, that access certain services on the platform, have to hold the token. So the amount of tokens that are floating freely in the ecosystem will continuously go down and make it a rare type of asset.
Got it. Okay. Ben, did you want to add anything there, or?
Well, I think Michael said the most. I mean, generally, we will have institutions holding a certain amount of tokens if they want to use, for example, our hospital information system. So they will have like a contract-based staking model. And as Michael said, we burn a certain percentage of token. That is, so for every advertisement payment, there will be a percentage burned. And we are talking about a very useful software that we are sure to onboard millions of people that can, benefit from healthcare services, and therefore will of course need the token. So we see definitely a high value of our token in the future.
Right. Yeah, great. And I just want to remind the audience to keep sending your questions. We've still got some time here. So I'm curious to know, are you guys already in talks or have partnerships going with some major healthcare providers that you can mention at all? And if not, it's okay. I'm just curious to know if there are partnerships in the works.
Well, we will release a list of partner hospitals. I mean, I think we mentioned some of them anyway. We have hospitals that we work in, of course, here in Europe, in Germany, where we are based, not anymore, but we were here. We were here when we started, and we were doctors here in the hospitals. So we have some hospitals that we work with here. But it reaches until Harare, with the Children's Hospital in Harare, for example. We have it's in Zimbabwe. We have our team in the Philippines working on partnerships with some bigger, but not only hospitals, even insurers. We are in talks with the AXA, for example, in Southeast Asia. Actually, there's a lot of interest from a lot of institutionals, even pharmaceutical companies. We did one experimental trial with a big pharmaceutical company, and there will be a lot of projects coming up with pharmaceutical companies. I think even the biggest interest is from pharmaceutical companies and insurers, but hospitals will use it as well, because it will just be in their interest to have better workflows, and we offer these support.
Right. And what about in terms of regulations? I mean, has that been a challenge, especially when it comes to data and collecting user data? How are you guys ensuring that the regulations don't hold this platform back?
The thing is that, as I've already addressed, this was one of our major focuses, because when you want to work internationally, you have to address the different legal areas, systems, regulations in Europe, as I said, GDPR in the United States, HIPAA compliance, or FDA compliance in some countries of Asia. So we addressed all that, which is difficult, and but that's not holding us back. The thing is, there is a demand, right? In the future, there will be people that don't have the possibility to go to a hospital. They will search for medical help. They will find an internet platform. Maybe they will find Aimedis. They need these services. You know, politicians, regulators, governments, you know, they have to adapt to this development, and especially in the established, so-called established Western world, in the United States, Europe, Germany, Netherlands, France, etc. You have certain regulations, but these regulations will, not all of them, but at a certain point, a lot of these regulations will be drawn back because there is a demand, right? There is a demand, and people will say, I need a video chat. I want to sell my data. I need a prescription. Do I have to die now? Do I have to be sick? Do I have to have pain? Or do I get it? Why is the regulation holding that back? And at a certain point, this will be established. That's not holding us back. We're just adapting, and we are adapting. Maybe on some parts, we are adapting very fast, very quickly. On some, we are maybe adapting slowly because some regulations are still there. But let's talk in 5 or 10 years, this situation will be a completely different one, and then we will be there.
By the way, I mean, we consider these problems, of course, from the beginning, and we have different strategies for different markets, of course. So we have an entirely different way to work in the Philippines than we do in Europe, and there are, of course, not the kind of obstacles that you will find here in Europe. So, but generally, we see a trend that supports all our aims in terms of regulations, because we see, I mean, we already have regulations in the US and in Europe that will step by step bring all the stakeholders on such kind of platforms. I mean, this is just the development, right? We're in a digitized world, and everyone that thinks that healthcare will be spared of these developments, I mean, he can do that, but it's not the reality. So even the regulators will be pushing hard towards a digitized healthcare space, and we are from the first. We are one of the first companies in this space, and I think therefore we will really benefit from these developments.
Right. I'm trying to better understand the challenges here, and so I think another challenge that might need to be addressed is what about, because with these underdeveloped countries, if they want to use this solution, what about Wi-Fi connections and connectivity? I mean, is that an issue, especially in regions where they don't really have that and they want to use your platform? I think that could be, you know, right up there with regulatory challenges in terms of.
Yeah, that's definitely an issue.
Yeah.
But we are developing the application in a way that even with a bad connection, you can work offline at a certain point, and after reconnection, synchronize everything. So you can hold it on your physical device on the one hand, and also use it in the cloud. So the problem about the so-called underdeveloped countries is that they are kept out from certain things because there's a big hurdle in terms of money. You know, a lot of people, or almost everyone in developing countries, third world countries, they have smartphones. They have the tools to use this. And that's what's so great about eHealth, because you can offer all these services in the same quality, in the same speed, the same time to people that are not as rich as someone who's living in Monaco. And that's also a good thing about the data. Let's imagine you're a hospital in Africa. When you sell data, it has the same value as the data from a hospital in Monaco or in Manhattan or in Los Angeles. So you're democratizing healthcare to a certain level with this kind of application and with this kind of marketplace and participation.
Yeah, those are really good points. Ben, did you want to add something?
Well, first of all, it's sometimes a little bit difficult to keep a good overview. I mean, we spoke about Africa, and Africa, it's funny because sometimes people really they don't have even enough to eat, but they have phones, iPhones or Android phones. So the access of internet is impressive somehow. It's, of course, there are some regions you don't have internet, but this is, I think, a question of a few years only, that we will have internet connections everywhere. But that's not, that's not our main issue, because, when we think about solutions, we try to reach a lot of people. We will never be the ones that, give solutions for 100%. This is not our aim. Because it's illusional. We want to have a solution for a majority of people, for the people that are interested, of course. Of course, there will be competition, and there will be companies with other ideas, maybe also good ideas that work in a different way. But we will be there, and I think we can get a good share of the market, which is important to us, and give benefits in return to the ones that use our system. That's the most important issue. We don't need every market. If you have China, you have already achieved a lot. You have the US, you have already achieved a lot. Of course, our aim is more, and we are already internationalizing, and we have very interesting discussions at the moment with US institutions. So I think the interest is there, and we will have our share. We will see how this develops, but generally we are very optimistic. We always work on something that is considered to be useful, and if we can succeed in that, I think the rest will be coming. So
what's also very important about the company is the fact that we are already working profitably. So we're not collecting money with the IDO to execute on ideas or to build something. We have a working product. We are working profitably. We made more than 1.4 million US dollars in 2020, and this year we will supposedly even double that revenue, right? So the company is on a very good way, and very stable, and the blockchain and token will be a great benefit for everything that is already there on a great base.
Right. Yeah. Awesome. So we have a few minutes left, so we're just going to start wrapping up here. Want to remind the audience, if you guys have any last minute questions, send it over in the chat. So final question for you guys, what can we expect moving forward? What does the future hold?
Yeah, so the next step will be the release of Aimedis Virtual Hospital, Aimedis Virtual Rehab, Aimedis Social Network, all these functionalities, the NFT marketplace, most importantly. So we are building continuously on the working system. And yeah, so we speed ahead as fast as possible and conquer as many regions as possible to be a major player in the field.
Rachel, I think what we have already proven is that we work on our targets, right? So it's very easy to look up our history, and that we are already working for a few years now on this product. So it's not that we just came up and tried to get something working and to get people on board and to make an IDO and cash out money. So we are working for a certain purpose, and we want to create something meaningful. And so generally, I would say we have already proven that we stick to our plans, we stick to our ideas, and that we will continue doing that. Of course, in interaction with the ones in healthcare, with the patients, and that's the very important issue,
Yeah, of course. Ben, you make a good point. I think that when it comes to a platform such as this one, we have to think less about the price of a token and what that maximum can be, and more about the technology and how this can help save lives. I mean, it's like the token is awesome. It's great. It makes sense, obviously, but we've got to be thinking about the technology with this type of use case. And that's what I'm so excited about.
Yeah. I mean, it's all about a product. If you have a product and people like your product and use your product and it gives some kind of value, the development is clear. It will follow even if it's lacking behind at the beginning. At a certain point, the intrinsic value will, come up to its monetary value or its token value.
Yeah, and people are really using it and adapting it. Especially in the last 3 months, we had great download numbers. Our Android app is already downloaded almost, I think, 400,000 times or so. At the moment, the Google Store says 100,000 plus, and the next step will be 500,000 plus. And that's only for Android. Also, the iOS app is going well. People that are using the system on the web is going well. Our target is to get 1 million users by end of 2021.
Yeah, I mean, COVID boosted us, of course, and all the healthcare, solutions, kind of kicked off. I mean, it's good for us in some way. The general situation is sad, of course, but there's another mindset at the moment that people really try to look into solutions in terms of healthcare.
You know what is very important? We haven't talked about the security of the system, which was one of the major points when developing this. We were even invited by World Economic Forum in July, and there was an explanation going on that where we were part of, and that we were talking about security, and we were taking part in their Cyber Polygon 2021, and we have a dedicated team that is only sticking to security issues. So we are real-time monitoring the system. We are always improving the security. We are hacking it continuously, doing penetration tests, stuff like that, to make sure that the user gets the most secure system that they can get. Because this is also one big issue when it comes to e-health.
Yeah, Michael, I'm glad you brought that up, and apologies that we didn't speak about that more in depth, because obviously keeping user data safe is a massive issue here. So I'm really glad you did briefly bring that up.
Thank you.
Yeah, but so unfortunately, we only have a few minutes left. I don't see any other questions coming from the audience, so I'm just going to wrap things up here. Michael and Ben, it's been a real pleasure. If the audience does want to reach out and, if they have more questions, for instance, about the security and all that, how can they get in touch with you guys?
So we have several social channels on Telegram and on Facebook and Instagram, but they can also contact us directly via email. contact@aimedis.com, very simple. Also via our website, we have a contact form, so you will always find a solution to contact us.
Great, awesome. And I just want to remind the audience, please subscribe to our YouTube channel. We're going to have more very interesting AMAs like this coming up. And I just want to thank everyone for joining us. Thank you again, Ben and Michael. It's been a real pleasure. And I look forward to staying in touch with you guys, because I'm excited about Aimedis, sorry.
Rachel, thank you so much. Thank you so much for a great opportunity to speak.
Yeah, thanks, guys. Have a good day.
Thank you.
Bye.
Bye-bye. Bye-bye.